Hey everyone! Hope you guys are doing great. Kamusta? Kamusta kayong lahat dyan? So yes, this is my very first video and thank you for stopping by at sa pagpansin nga dito sa vlog na to. Medyo kinakabahan pa ako. Medyo awkward ko yung pag-film at pag-record pero gagawin natin to. Papasukin natin ang mundo ng vlogging. So yes, so basically yung content natin, it's all about sharing my pregnancy journey, life updates, and everything in between. So I'm hoping na maging supportive and masaya lang na community tong channel na to, and I'm just so excited to share everything. I hope I can learn or hear stories from you also, the viewers. We can learn from each other. And so yeah, if you're here watching, thank you for being part of my very, very, very first vlog. Let's do this! Okay, so in this video, I'm going to talk about my pregnancy journey. So my very first pregnancy. So from conception, pregnancy, complications that I went through, and a little bit story or details lang din nung delivery ko. So yeah, I'll try to cover these three, especially yung mga important details, to make this video as helpful as possible for you. But before I get into this video, I just wanted to take a moment and acknowledge something really important. I know that pregnancy can be a very, very sensitive topic. So if you're someone who is currently, struggling to conceive, and you feel like, this video might not be for you, please, by all means, you can skip away, you can click away, and I will totally understand. Ayoko naman na maging reason tong video na to for you to feel down or trigger any negative or any difficult emotions. Your well-being, what matters most. Kaya, yeah, and if you feel better about it, you can always come back and watch this video. Just know that I'm sending you love and support. Alright, let's get started. Back in September 2023, my husband and I decided that we're ready to be pregnant. Feeling namin pares na kaming ready physically, mentally, and emotionally. So yun, as most of our family and friends know, my husband and I were actually in a long-distance relationship for 7 straight years. So, after getting married and finally being together, having a baby wasn't our first thought. Hindi talaga siya yung una namin iniisip nung time na yun. So, we wanted to cherish each other's company muna. Yung kami lang muna talaga. So, we got married in 2021. And then, after 2 years, syempre, we talked. And then, we finally decided na ready na kami. We're ready to be parent. So, if you're wondering, if you're asking if we felt pressured before conception, the answer is yes, absolutely. Syempre, yung mga constant questions from some of our family or some of our relatives, some of our friends, yung mga question like, when are you gonna have a baby? Why aren't you pregnant yet? Diba? Parang, yeah, it really adds up to the pressure. These questions may seem harmless, but truly, they can be stressful and emotional. So, nakakadagdag talaga siya sa pressure. In my opinion, if you're in that kind of situation, the best way to respond to those people who try to rush you is just to simply smile back. There's no need for you to explain your side. Hindi mo kailangan i-explain yung timeline nyo. There's no need for you to justify your situation. And I just really hope that, everyone will be mindful and, let's refrain from asking these questions kasi hindi mo ma-realize these kinds of words, they can be hurtful and sometimes it can deeply affect someone's emotions. Let's just choose kindness and sensitivity in our conversations. So, the next thing that we did was to have my cervix checked. Kaya nagpa-appointment ako agad sa family doctor namin ng pap smear test. For me, this is very important, lalo na if you're planning to conceive. Para lang may peace of mind ka at alam mo na magiging okay yung pregnancy mo, walang problema sa cervix mo and all. And, well, in fact, hindi lang pala siya hindi lang siya sa planning mag-conceive. If you are 21 years old and you're sexually active, it's recommended for you to do a pap smear test. Kaya, if you're that person, I would suggest magpa-schedule ka na for pap smear. You know, it's a early detection for any potential issues like cervical cancer nga. So yun, after 24 hours of waiting, thankfully okay naman yung pap smear test result ko. Okay yung cervix ko. So that's the time that my husband and I started trying. By the way, I also started drinking prenatal vitamins. So ito yung iniinom ko up until now na nasa postpartum stage tayo. So yes, it is recommended to start drinking prenatal vitamins at least 1 or 2 months before conception kasi it will help support the growth of the fetus. So any prenatal vitamins will do as long as meron siyang 1,000 microgram na folic acid. For me, it is best if you seek advice from your doctor kung ano yung recommended niya na prenatal vitamins kasi depende talaga siya sa brand. I heard that there are some side effects like nausea, bloating, constipation, and even heartburn. So, it's best if you seek advice from your doctor. Hindi ako active person. I don't go to gym. I don't have regular exercise. But ever since nag-start kami to try to conceive, that's the time I started, engaging myself to moderate exercise like jumping rope and activities reducing stress. Ayun, fast forward, after all the preparations we've done, we finally tested positive. So after we found out that we're pregnant, I immediately booked an appointment with our family doctor. So 1 week pa lang, alam na namin na buntis na kami. Yun, syempre, by following my period calendar and following the first day of my last menstrual period, dun mo kasi malalaman na or mag-umpisa yung week count ng pregnancy mo. And the doctor will also tell you kung ano yung due date. So yun, our family doctor referred us to do lots of blood works. Hindi ko maalala exactly kung ilang vial of bloods yung kinuha sa akin. I would guess 4 or 5. So yeah, they also referred us to meet with prenatal team. So it's a shared clinic. So shared clinic siya and iba-iba yung mga OB/GYN doctors na nag-handle sa akin all throughout my pregnancy. So lahat ng check-up ko, iba-iba yung doctor na nami-meet ko. So yun, unfortunately, my blood works resulted that I have iron and vitamin B12 deficiencies. So yun, dinagdag ko tong supplements na to sa tinitake-in ko na prenatal. Well, yung prenatal vitamin, meron naman na siyang iron content pero hindi siya enough. That's why my doctor prescribed one for me. So, yung vitamin B12, tinitake ko siya once a day. Daily yon. Pero yung iron, yung supplement na iron, tinitake ko siya 1 tablet every other day. Kasi meron siyang side effect na constipation. So, it's either after taking in the iron supplement, inom ka agad ng vitamin C. Or, yun, dagdamihan mo yung food mo rich in fiber. I had my first ultrasound at 9 weeks and then another one at 13 weeks. So, dito rin sa 13 weeks na to, ginawa yung first trimester screening. It's optional, pero we just decided to say yes. The purpose of that is to assess the potential risk of chromosomal abnormalities like Down syndrome. So, dito, ino-offer nila for early detection. And yun nga, thankfully, after waiting for, I think, 2 days, pasado naman yung measurement ni baby. Meaning to say, hindi siya candidate or wala siyang risk of Down syndrome. So yun, ginagawa siya at 13 weeks. During my 20 weeks, aside from finding out my baby's gender, dito rin nila napansin na there's something's wrong with the umbilical cord. So yung ultrasound, hirap sila makita kung saan naka-attach. So yun, medyo nagtagal dun sa ultrasound nung time na yon. And they were telling us na abnormally attached nga yung umbilical cord ni baby sa placenta ko. So, this is the normal look of a placenta and then ito yung sinasabi nila na situation nga nung cord or umbilical cord ni baby. So, they call that Velamentous cord insertion or VCI. So, they cannot confirm that yet. Kaya ang ginawa namin, ginawa nila, they referred us for a consultation with maternal fetal medicine. Yung maternal fetal medicine kasi dito, it is located sa, I would say, bigger city. So, it's a 2-hour drive from where we live. And masasabi mo mas high-tech yung equipment nila. That's why they referred us to do another ultrasound in that hospital nga. So yun, sadly, they confirmed that my baby's umbilical cord is attached in my placenta in an abnormal way nga talaga. So, it is really the Velamentous cord insertion. So, first time nating marinig yun, syempre, best friend natin si Google, diba? So, they said, and also the doctor confirmed there na very rare yung ganung condition. And unfortunately, isa nga tayo sa nakaranas. At first, we were very worried. Like, sabi ko nga, Google yung best friend natin. Like, lahat ng mababasa mo about VCI, it's high-risk condition. Mas sinasabi doon na there's like a risk with pregnancy, like, preeclampsia, abnormal fetal heart rate, preterm birth, cesarean delivery. So, it's really, alarming and nakakapag-alala siya sa part mo. However, when, naging honest kami sa doctor namin na yun yung inaalala namin, the doctor, confident siya naman na sinabi na there's nothing to worry about. Ito yung itsura ng cord, no? So, that's the way it's attached to my placenta. Ang worry ko kasi doong time na yon, isa pa palang worry ko nun is hindi enough yung nutrients na nakukuha nga ni baby or no fetus. So, yeah, sinabi naman ng doctor na since okay naman yung weight ni baby because they measure that during the ultrasound, diba? So, sakto naman siya sa kung ano yung age niya per week. So, they confirmed that's okay. And, alam mo yun, naging at ease yung pakiramdam mo kasi they said that may mga cases talagang nangyayaring ganun. So, you're not alone. It's so, yeah, they said that ang purpose lang naman kaya kailangan i-document or i-report yun sa file or sa record ko bilang pasyente is, para dun sa doctor, kung sino yung doctor na magdi-deliver kay baby, aware siya na yun yung condition, yun yung situation ng cord attachment or umbilical cord attachment ng baby. And, for extra precaution na rin, masasabi for extra precaution. But, syempre, hindi dun nag-stop. Kahit na sinabi na ni doctor na there's no need for you to worry about, nothing to worry about, diba? Pero, ikaw, as a mom, as a first-time mom, parang hindi maaalis dun yung pag-alala mo. So, what I did on my part, syempre, yun nga, I made sure na I'm eating the right food, and then, I get enough sleep. So, yun talaga. Lalo na sa third trimester. Aside from having VCI or the Velamentous cord insertion, I also failed the glucose test, meaning I have gestational diabetes. So, yung screening na to, ginagawa to between 24 to 28 weeks of pregnancy. So, yun kasi if hindi siya na-manage carefully, it can lead to high blood sugar levels. So, high blood sugar can cause problems for you and your baby. Kaya, yun, may risk siya of, needing of surgery or a cesarean section and obesity and type 2 diabetes later in life. Kaya kapag nag-fail ka sa glucose test screening dito sa Canada, they will ask you to attend a diabetes education program. Dito, tuturuan ka nila kung paano magbasa ng nutrition label, teach you how to eat healthy and in mga physical activities and stress management. Basically, mga ways to prevent any complications. Meron ka ring dietitian dito na mag-monitor. So, they will check your glucose report and food logs every other week, diba? So, tatawagan ka talaga nila for monitoring. So, if your numbers are so high at hindi kayang daanin through diet control, that's the time they will refer you to insulin injection. So, luckily, sa experience ko, nadaan ko naman sa diet control and okay naman yung mga numbers na pinipresent ko sa dietitian ko every other week na nag-meet kami. So, it still depends on the assessment ng dietitian basically. So, yun. You really have to log all the food you're taking in and also yung blood sugar na nire-record mo. So, for me, ang monitoring ko is first thing in the morning. So, that's before meal. So, pagkagising mo, magpiprick ka, you check your blood sugar, log it, and then now you can eat your breakfast. So, after eating your breakfast, that's the time you will count 2 hours. So yun, after 2 hours, magpiprick ka, record mo, and then you can eat snack naman in between. You just have to log it also dun sa food logs para lang din ma-review ng dietitian. Well, it is really a struggle to be honest with you guys. Pero kailangan mo talagang mag-prick and gawin siya every day for 4 times and then record or document everything. Okay, so due to having gestational diabetes, I would advise na hindi na kami papaabutin pa sa 40 weeks or sa uh, due date ko. So 40 weeks, talagang before 40 weeks, dun na talagang i-schedule ka for induced labor. So yun nga, they told me or the doctor told us that if hindi pa ako mag-labor before my 39 weeks, they will schedule me for induced labor. So the reason why they planned this for my delivery, dahil nga high risk eh. High risk yung bata na baka mag-overweight siya and then ako rin yung mahihirapan mag-deliver. Baka maging cesarean section pa eh. Ako kasi personally, I prefer natural birth. So I accepted that and then, parang kinonsider ko din yung condition nga ng cord ni baby na medyo hindi siya naka-attach ng the normal way or the usual way. So, parang natatakot tayo na maging overweight si baby and then chances na baka mapigtas, di ba? Yung mga wild imagination as a first-time mom. But yeah, anyway, so yun. Na-induce ako 39 weeks and they offered me 2 options pero yung pinili ko lang nun is the Cervidil. But before that, before my 39 weeks, meron pala tayong 37 weeks. So, yung pinaka-last na appointment ko. During my 37 weeks appointment, they also offered me the Group B Streptococcus test or the Group B Strep test. This is to check if you have this bacteria while you're still pregnant. Itong bacteria kasi na to, if you have that, it will not harm you as the mommy, pero it may harm your baby after birth. Sabi rito, it can cause serious illness in newborns. So yun nga, sadly, I tested positive. So the way they administer this test is by taking swab, both the vagina and then your rectum. Yan. By the way, hindi pala lahat nakakaalam tong test na to, kaya consider this a little tip or a heads up. And yeah, so this is done during third trimester, around 35 to 37 weeks, by the way. So if you want more information regarding this, might as well take a look into it or you can always ask your doctor. Dito kasi sa Canada, it's optional, pero again, since libre naman and then it's for early detection, di ba, might as well do the test na rin. So yun nga lang, dagdag nervyos or dagdag worry siya. But, yun, ang sabi naman dito is, kaya ginagawa tong screening na to, again, it's for early detection to make sure na ma-wash out yung, alam mo yun, make sure na safe si baby after birth. Hindi naman masakit yung pag-swab or the way they do it. It's just super uncomfortable. Naalala ko paano ginawa. But anyway. So yan, isang malaking Q-tip yun or cotton buds, what we call it cotton buds. Isuswab siya nga sa vagina and same swab. Tsaka isusunod dun sa rectum mo. So, pasintabi sa mga kumakain. So, yeah, since positive tayo, I was instructed to just declare it to the hospital kung saan ako manganganak. The reason behind kasi is before giving birth, so syempre nag-labor ka na, no? So during labor, dapat bibigyan ka nila ng antibiotics through IVF. So at least 4 hours before your delivery. So yun yung instruction. Alam mo yan, so parang marami kang inaalala pero may mga mga solution naman, di ba? Yeah, okay, so 39 weeks arrived and still hindi pa ako nagla-labor, kaya kinabukasan they scheduled me for induction. So we went to the hospital and they offered me 2 options for the labor induction. Ang pinili ko doon is the dinoprostone insertion or also known as the Cervidil. Alright, for now, that's about it. Again, the main purpose of this video is to share that, after all the pregnancy complications that I went through, I wanted to let you know that everything went perfectly fine. I delivered my baby healthy and he's now 3 months. So, yun nga, mga kagaya kong first-time moms, I know there will be moments na you feel like you're blaming yourself, especially if you have the gestational diabetes. Please, never ever blame yourself. It's not about the food you take or your lifestyle. It's just how our body reacts with pregnancy. So, yun nga, may mga ibang buntis na it's their first time also, and then they have gestational diabetes, and then for some mothers or for some moms, sa first pregnancy nila meron, and then sa second pregnancy nila wala na silang gestational. It's just every pregnancy is different. So please remind yourself that you're doing a great job and your baby is just doing fine, okay? If you're going through something similar, know that you're not alone and that you're doing an amazing job. Remember, pregnancy is not always easy. Hindi siya yung laging sobrang happy lang lagi. No, there are times na nakakapagod talaga, super tiring na, and iiyak ka na lang din sa sulok. But remember, yung moments na malapit na nating ma-meet yung baby, our little ones, that's all worth it. And you're doing your best, and that's what matters the most, okay? So you got this. If this video helped you in any way, don't forget to like, comment, and subscribe. I'd love to hear your stories too, okay? Sending you all love. Until next time, take care, mama.